Quick note, we're still adding content to the coupon course. It is still on pre-sale for only $20, so get in now, bro. Believe me, you'll be glad you did. What's up, everybody? It's your boy Chainsaw, and in this video, we're going to go over some of the articles you may have missed in the last couple of days, some new updates happening here in the state of Missouri, and some of the things that I found out while you were sleeping. So let's just jump right into this. Firstly, don't forget, you can get your 2 free stocks with Weevil. Click on the link down below, deposit $100, set up an account. Weevil will send you 2 free stocks, listed up to $1,600, $1,680. Also, do the same thing with M1 Finance, chainsawccc.com/M1. M1 Finance will send you $50 right now just for starting an account. Deposit $100. That's a real quick 50% return on your money. But let's just jump right into this because we got a lot to unpack here. Firstly, Governor Mike Parson, this is, of course, recorded on the 24th. So Governor Mike Parson had posted on his personal Facebook page as early as July 20th. Let's pull this up here. Nope. Vaccinations continue to be the best method of COVID-19 protection, and we encourage anyone age 12 and up to get vaccinated to help protect themselves and those around them. Well, good to hear that he's getting himself involved. You know, and notice there were no retractions on that. No, didn't pull any punches like, we've seen in the past here. Just simply, we encourage everyone to get vaccinated, help protect themselves. Nothing about how, I got vaccinated after I'd already had COVID and had mild symptoms, and, none of that nonsense. People are dying, and I think finally this guy's starting to get the message. But includes a nice little county map. This is from health.mo.gov/community test. And again, this was posted July the 20th. So COVID-19 resources. So check out this bad boy. Well, look at Wright County, Dallas County, Greene, and Christian counties. This is shared from Missouri Department of Health and Senior Services, again, on July 20th. Laclede, Phelps, and Pulaski counties, your counties are experiencing a surge in COVID-19 cases over the last 14 days. Disease is expected to move east from southwest Missouri along I-44. Delta variant, which spreads more easily and poses a higher risk of hospitalization than prior variants, is believed to be contributing to the increase. Vaccination continues to be our best tool to move past this pandemic. Case numbers for the last 14 days, approximately. Laclede County, as of July 20th, 217 total cases. Phelps County, 294 total cases. Pulaski County, 210. Vaccination rates in Laclede County, 24.3%. Phelps County, 31.3%. Pulaski County, 32.5%. Counties are below the state. Counties below the state rate of more than 40%. Experts say at least 70 to 80% of people need immunity to minimize spread within a community. COVID-19 resources, of course, are including links. Those who choose not to get vaccinated should continue these important public health steps. Maintain at least 6 feet of distance from others. Wear a mask when appropriate. Avoid others that appear to be sick. Avoid others if you have COVID symptoms. Cough or sneeze into your elbow or a tissue. Wash your hands. Don't be nasty. So there's that. Good to see that the governor's, at least appearing to somewhat take this significantly more serious than he previously had been. So that's awesome. Let's take a look at this. This is a KY3, the place to be. Oh, nope. KY3, the place to be article. This is from, July 22nd. So 2 days later. Missouri to send, Missouri to send more personnel equipment to Springfield area as COVID-19 spikes. So it looks like we're doing something about this. Let's take a look. Missouri state leaders will send additional personnel and equipment to Springfield and Greene County starting Friday to assist in Southwest Missouri's fight against COVID-19. Governor Mike Parson announced the new resources on Thursday in a news release, which his office says comes in an effort to support local health care systems after requests from Springfield area health leaders. Throughout this pandemic, we've worked with our local partners to provide support and resources as quickly as logistically possible, and that's not changed. Governor Parsons said, "We are thankful for these medical professionals and the assistance they will provide in Southwest Missouri. We'll continue to do all that we can to support the Springfield area and surrounding communities as we experience this increase in COVID-19 spread." It's the same guy who was just, talking about they're just looking for somebody to blame recently. I don't know. That's a whole thing. The decision comes nearly 2 weeks after Springfield hospitals submitted a request to Missouri health and emergency leaders for a COVID-19 alternative care site to aid Springfield hospitals with their growing COVID-19 units. The state will provide new resources such as ambulance strike teams, monoclonal antibody infusions facility, which I think KY3 did an article on that also. Immunologist Dr. Min Tu says she's concerned if cases continue to rise, another variant can form in the future. Well, I've already seen people mentioning the Delta variant, renaming it the Parson variant, so keep your eyes peeled for that. Don't forget Lambda coming to a county near you this fall. If we keep letting people get infected, and these are unvaccinated people, every time it infects somebody that's unvaccinated, they can form a mutation, Dr. Lave says. And that's where these mutations are coming from. So, yep. So when you come across folks who ask, "Oh, well, if you're vaccinated, how come I have to get vaccinated?" Well, that's just because kind of that's how that works. Cox's internal medicine physician, Dr. Nana Gacy, says the hospital is seeing some unvaccinated patients get a virus a second time. So I guess there shoots that theory. Rand Paul, are you listening? Patients who had COVID last year are getting reinfected this year, and some of them are admitted into the hospital. This is concerning for Dr. Gacy because patients are getting seriously sick. Severe lung disease, lung fibrosis, and most of these patients are having to be on home oxygen at the time of discharge, Dr. Gacy says. Starting Friday, ambulance strike teams are expected to arrive in Springfield area and be available to assist local hospitals. The teams will consist of 10 advanced life support ambulances, 20 medical personnel, 2 strike team leaders, and 1 logistics specialist. They'll support transports of COVID-19 patients. Additionally, the Missouri Disaster Medical Assistance Team is now providing equipment, personnel, working with Jordan Valley and other healthcare facilities in supports of the monoclonal antibody centralized infusion center. The center is expected to begin receiving patients for therapy treatments as early as Friday, July 23rd. So this is starting in yesterday. Again, this is posted a couple of days ago. Monoclonal antibodies are proteins that can help your body fight off COVID-19, reduce the risk of severe disease, hospitalization, if administered to high-risk patients soon after diagnosis. So still, looking forward to making some changes here. All right. And that's great news. It really is. Definitely looking to push forward here. Again, posted July 22nd here. This is also from KY3. I guess that's why they call it the place to be, right? Since July 1st, Missouri's COVID cases average has jumped 161%. Hospitalizations have increased 58%. And we'll get to that here in a minute. Hospitalizations and case numbers continue to skyrocket. According to the Missouri Department of Health and Senior Services, the state has recorded 551,609 cumulative cases of SARS-CoV-2, an increase of 2,418 positive cases, and 9,534 total deaths as of Thursday, July 22nd, an increase of 8 over yesterday. That's a case fatality rate of 1.73%. So, yeah. Please keep in mind that all cases and deaths recorded occurred in the last 24 hours. Approximately 2.48 million people have completed the vaccination process in Missouri. 57.3% of all adults 18 or older and have initiated the process. The state has administered 75,885 doses of the vaccine in the last 7 days. This metric is subject to a delay, meaning the last 3 days are not factored in. The highest vaccination rates are among people over 65. Jesus Christ. Only 5 jurisdictions in the state are over 40% fully vaccinated: Boone, St. Louis, St. Charles, Franklin counties, and the city of Joplin. So I'll let you read that. The Bureau of Vital Records at DHSS performed a weekly linkage between deaths to the state and death certificates to improve quality and ensure all decedents that died of COVID-19 are reflected in the systems. As a result, the state's death toll will see a sharp increase from time to time. Again, well, we could do better. That does not mean a large number of deaths happen in one day. Instead, it's a single day reported increase. At the state level, and this actually has as just what I've seen in public commentary, and I believe one of these local news journals has done an article on this. That's actually one of the reasons that people, the average lay Missourian has maybe gotten disinformed on how this record keeping. It's not just in Missouri; it's across the country. I've seen this stuff mentioned in headline news. The folks are seeing these increased reporting, and then that's part of why they started claiming that it was a hoax in the first place. So, and some states are doing a better job of record keeping and reporting. Some counties here in the state are doing a better job than others at record keeping and reporting. So, if you're not keeping it accurate, I know your job's hard, and I know that times have been troubling, and I know that this has been going on for a year. But if you see somebody, if your partner next door, if the county next door, the county health department next door is, doing something that is more efficient than the methodology that you're doing, just get in touch, reach out, find out what the difference is, and do better. Because there are too many stupid people out there who think that you're all doing a bad job. So just take that from me. Where was I? The 10 days with the most reported cases occurred between November 7th, 2020 and January 8th, 2021. The 7-day rolling average for cases in Missouri sits at 1,631. Yesterday it was 1,615. Exactly 1 month ago, the state's rolling average was 477. Approximately 47.7% of all reported cases are for individuals 39 years and younger. The state has further broken down the age groups into smaller units. The 18 to 24 age group has 69,389 reported cases, and while 25 to 29-year-olds have 46,924 cases. People over 80 years of age or older account for approximately 47.4% of all recorded deaths in the state. So that's less than half. Missouri's administered 5,950,874 PCR tests for COVID-19 over the entirety of the pandemic. And as of July 21st, 16.1% of those tests have come back positive. People have received multiple PCR tests are not counted twice, according to the state health department. And you'll hear that too. That's all part of these crazy, kooky conspiracy theories. But I guess that's half the fun, right? All right, now for a little change of pace, just to kind of reflect some of the things that I have been posting on recently, and just to show that maybe I'm not as crazy as I even thought I was there for a while, right? Let's shoot on over to ozarksfirst.com. This is help wanted signs still up. A month after federal unemployment benefits end. What? Oh, get that out of here. Sorry about that. Over a month after added unemployment benefits ended for Missouri, many businesses are still seeking employees. Some, including Governor Parson, believe that the extra $300 per week encouraged people to stay home instead of looking for jobs. Well, what do we think now? Others said that ending the benefits would hurt families who rely on the extra assistance during the pandemic. A month later, many businesses are still boasting help wanted and now hiring signs. Several are reducing hours because they do not have the employees to stay open during these hours. According to the Job Center, one possibility is that big employers are competing for area employees. Maybe it has something to do with why this was a problem back in 2018, but I don't know. I'm just some guy. I'm just some guy. I'm just some guy who ended up getting put in a corner, you know. So there's that. Amazon and Costco both are hiring hundreds of employees for their new locations in the Ozarks. Those jobs did not exist before the pandemic, and people now have more options for employers. You know, that might have something to do with it. That's that's capitalism for you. So who knows, really? Come on, folks. Let's get real here. So, what does that mean for unemployment benefits? Well, it means nothing. Is Governor Parson going to apologize? Likely not. Is he going to just decide that he was wrong? He made a mistake. When was the last time you saw a politician do that? Certainly at the state level. The General Assembly is not going to stop him. Um, I'm not allowed to do anything about it, so you might have to count me out on this one. Good luck. But moving on. Oh, there we go. This is from KY3, posted on July 22nd, 2021. Patients beg for COVID-19 vaccine just before intubation, doctors say. Begging for it. Are you kidding me right now? This is horrible. This is horrible stuff. I mean, this is just really this is really just disgusting stuff here. You know. And to think that there are still the conspiracy theorists out there just pandering this garbage to people. But let's move on and find out. Doctor from Grandview Medical Center in Alabama is trying to make an impact on Facebook to encourage everyone to get the COVID-19 vaccine. This is posted by KY3, apparently the place to be. Dr. Brittany Cobia says she's admitting young, healthy people to the hospital with very serious COVID-19 infections. These patients beg for the vaccine just before they get intubated. Jesus Christ, the doctor explained on social media. I hold their hand and tell them I'm sorry, but it's too late. Wow, man. I posted on the doctor's Facebook there. I've made a lot of progress encouraging people to get vaccinated lately. And you want to know why? I'm admitting young, healthy people. Young, healthy people at a hospital with very serious COVID infections. One of the last things they do before they're intubated is beg me for the vaccine. I hold their hand. I tell them I'm sorry, but it's too late. A few days later, when I call time of death, I hug their family members. I tell them the best way to honor the loved one is to go get the vaccine. Jesus Christ. That's posted on KY3. You can check that out yourself. That's mortifying stuff right there. Kobe shared a post from Dr. David Wilhelm, who's predicting that there's a significant likelihood for people who have not had the COVID-19 and are unvaccinated to catch the Delta variant in the next 60 to 90 days. As patients die, Kovia says she hugs their family members and tells them to honor their loved one by getting vaccinated. They cry. They tell me they didn't know. And no. On the one hand, I get the frustration. I have the frustration when you see things like that you didn't know. On the other hand, I expected people to know. I mean, you've got, on the one hand, all of these just conspiracy nuts out here pushing this disinformation about COVID. I mean, this happened from the beginning. It's 5G. They got trackers in them. They got... It's given people COVID. And I mean, when you've got, news media, partisan news media, you got politicians. Now you got local politicians. You got local politicians at your state and county level. I know you've seen this. Pushing anti-vaxxer propaganda. Garbage. Where does the responsibility take place? They either know what they're doing by spreading this information and killing people, or they don't. And I don't know if that's your job, if you're getting paid for it, and you kind of have to take responsibility for that. So, I have no words. I go back to my office, write their death note, and say a small prayer that this loss will save more lives. Corbia said. Grandview Medical Center updated its visitor policy Thursday due to the ongoing spread of COVID-19. Everyone inside the hospital must wear a mask regardless of vaccination status. Good. And patients may only have one visitor. Usually no children are allowed to visit because obviously children are also having problems because of this variant, because of COVID in general, but especially here, here in the state level also, because the Delta variant, the Parson variant, whatever the hell you want to call it, right? And to think that there are people that we trust, that we pay with our tax dollars, that you pay every year. When you go to the store, you buy a pop, you buy a beef sandwich, you buy a beef jerky, you buy a pack of smokes, a 6-pack of beer. You pay your electric bill, you can pay your taxes on your car. Those funds go directly to people in government who are just lying to you about COVID-19. And people are dying as a direct result of their stupidity, just idiocy. I mean, stop it. Worst part is some of these folks are medical professionals. Take some responsibility, damn it. So we'll jump into this again. KY3. Well, I'm going to stop posting articles from KY3. Either they're going to have to start paying me for this, or I'm going to have to start paying them. But don't sue me, bro. So this is from July the 23rd. So at least we crossed the day, right? Missouri Health leader rhetoric against COVID-19's vaccine. Well, somebody else thinks this is a bunch of baloney too. So let's read about that. July 23rd. Missouri's acting health director speaking up on disparaging remarks about the COVID-19 vaccine, calling rhetoric against the vaccines a bunch of baloney. Right? Robert Knodell was named the acting director of the Missouri Department of Health and Senior Services after the resignation of Dr. Randall Williams in April. On Thursday, he expressed his concerns via Twitter. I'm not one to vent on Twitter, but enough is enough. All this rhetoric against COVID vaccines is a bunch of baloney. Knodell's comments come as Missouri has sent new resources to the Springfield amid a surge of COVID-19 cases and hospitalizations. Ambulance strike teams have arrived to the area. Health leaders say vaccines are the best defense against COVID-19. Roughly 40% of eligible residents in the state and in Greene County are fully vaccinated, but we'll get into that here in just a minute. Yeah, so good for him. Good for him for speaking out. Good for him for speaking out and on behalf of the folks who are struggling through this. I mean, this is some crazy stuff. So we can't leave the government completely out of this. Specifically, the state government. Parson and the crew have put together a little taste of something here for you. A little program for those who haven't been vaccinated yet. You might have just hit the lottery, bro. Again, this actually, so to retract, this is posted on July 22nd. Should have ordered those a little better. More than 100,000 sign up for Missouri's vaccine incentive program on the first day. Wow, really? Really? It took money? You wouldn't do it? You wouldn't do it for patriotic duty. You wouldn't do it for a sense of community. You wouldn't do it to save your aunties, to save my aunties. For your wife, your kids, yes. Neighbors' kids. 100,000 people do it for cash, though. Cold hard cash. Here we go. Missouri launched a statewide COVID-19 vaccination incentive program. Mo VIP, because you are all very important, if not special people. On Wednesday to encourage vaccination among all eligible Missourians. More than 100,000 people have signed up for a drawing through the state's vaccine program after its first day, according to Missouri Department of Health and Senior Services. The Mo VIP incentivizes vaccination for those who have not yet been vaccinated, as well as provides an opportunity for rewards for 2.8 million Missourians who have already made the decision to be protected through vaccination. Well, that's good, because, some people actually gave a damn. I'm just saying. Missourians who've received at least one dose of COVID-19 vaccine are now eligible to win One of the 900 prizes, those vaccinated can win cash or education savings. The education savings account prizes in the amount of $10,000. New program will complement our existing efforts to educate Missourians about the importance of getting the vaccine, said Governor Mike Parson. Our current COVID-19 situation is serious. The Delta variant transmits faster than we have previously seen, and it's more likely to impact children and the unvaccinated. So now's a perfect opportunity. Yeah, you're a little late, bro. And come on, man. We knew about this long ago. I don't know where you've been, but maybe respond a little quicker. A little more action, maybe a little more pro-action. As opposed to last year. This has only been going on for over a year. Keep in mind this is the same guy who said that health is number one. So if you don't feel comfortable and safe going out and voting, then you probably just shouldn't. I mean, he said that over a year ago from the elections last year, back in May 2020. So same guy. It's a little slow on the draw, just a little slow on the draw, Governor Parson. So let's see. Kansas City. This article, again, through KY3. Well, I'm just going to start going straight through Associated Press. Associated Press article through KY3. This is done January 23rd. Kansas City area medical leaders may urge new mask mandate. Yeah, I wonder why. You can only imagine, right? Kansas City, Missouri. As Delta variant COVID-19 makes its way through the Kansas City area, the region's medical leaders appear to be on the verge of calling for new mask mandates. Dr. Steve Stites, Chief Medical Officer at University of Kansas Health Systems, has said that the region is seeing a big increase in patients. The Kansas City Star reported, we're past the tipping point. We're in trouble, bro. Missouri's at the epicenter of the summer surge. The spread has made its way to the urban areas too. St. Louis City and county leaders ruled out new measures such as mask mandate, social distancing requirements as the region faces. Are you kidding me right now? Mask mandates, man. Come on, all these anti-vaxxer people. I mean, isn't it just charming that you guys weren't for the lockdown? Okay, cool. So we can't lock down businesses, otherwise there's going to be, riots in the street, people out there screaming at cops, and just going nuts, making threats about a revolution, right? So okay, so we in the lockdowns. You don't want to wear a mask, you don't want to social distance, and now you're all out there freaking dying because you don't want to get the vaccine. You don't want to get vaccinated. Boy, Operation Warp Speed though. Warp Speed to what? This is crazy. The only thing that's partisan about this is that and I say this a lot, and I mean this in the most lighthearted way, that it isn't a Republican thing, it isn't a Democrat thing, but the only thing partisan about this is the morons who want to make this partisan. I mean, you people need your own party or something. Just wow. There's something just crazy going on here, and it'd be pretty large following. We're looking at right at 23 to 26% of the country. Just a bunch of conspiracy theorist nuts based on some of these reports. But we'll get into that. So they're looking at mask mandates here in Kansas City. Well, that's fun. Southwestern Missouri continues to see the worst of the surge. Republican Governor Parson announced Thursday that 10 advanced life support ambulances, okay, we already read about this in another article, set to arrive Friday in Arkansas. We'll continue to do all that we can to support the Springfield area and surrounding communities. Just wait until some stuff happens up in Kansas City and St. Louis, though, right? It's only going to get worse before it gets any better. We can see that. So, let's see, is this an AP article? This is an AP article. This is a fun one. Again, KY3. I'll start pulling these straight from Associated Press before KY3 decides to sue me or something. Don't sue me, bro. Nope, not that one. I'll get that in a second. States scale back virus reporting just as cases surge. It's got to be that 23%, right? A bunch of whack jobs. published July 24th. This was today, 10:07 Eastern time, so 9 U time, right? Omaha, Nebraska, Associated Press, several states scaled back their reporting COVID-19 statistics this month, just as cases across the country started to skyrocket, depriving the public of real-time information on outbreaks, cases, hospitalizations, and deaths in their communities. What I say earlier in this video, do better. Yeah, this ain't it, bro. This is doing worse. This is doing the exact opposite of that thing that I said that you should be doing. Great job. Great job. The shift to weekly instead of daily reporting in Florida, Nebraska, Iowa, and South Dakota. Who's surprised by that? Marked a notable shift during a pandemic in which coronavirus dashboards have become a staple for Americans closely tracking case counts and trends to navigate a crisis that's killed more than 600,000 people in the United States. In Nebraska, the state actually stopped reporting the virus altogether for 2 weeks after Governor Pete Riddick declared an end to the official virus emergency. I'm going to have a stroke right here, and you're going to, oh, God. Forcing news reporters to file public records requests to return to national news websites to track their state data to learn about COVID statistics. The state backtracked 2 weeks later, came up with a weekly site that provides some basic numbers. This is very much akin to the same garbage we saw from Governor Mike Parson when asked during his press conference about how many Missourians his slashing of unemployment benefits was going to affect. And his answer is, if he knew, and his answer to the question of if he knows how many people it will affect is a simple no. Contact the Department of Labor for that information. Are you freaking kidding me? I mean, he probably said no because he didn't know, which is real. And Governor Pete Ricketts of Nebraska probably just stop it. Other governments have gone in the other direction, of course, and released more information because that'd be the smart way to do it. With Washington, D.C. this week adding a dashboard on breakthrough cases that showed number of residents who contracted the virus after getting vaccines. Many states have recently gone to reporting virus numbers only on weekdays. When Florida changed the frequency of its virus reporting earlier this month, officials said it made sense given the decreasing number of cases and the increasing number of people getting vaccinated. Cases start soaring soon after. Yeah, because, when you stop taking the situation seriously, that's when you encourage all the whack jobs to come out and start, just spreading the information, misinformation. That's a thing. Cases started soaring soon after. Florida earlier this week made up 1/5 of the country's new coronavirus infections. As a result, Florida's weekly releases, typically done on Friday afternoons, have consequences for the country's understanding of the current summer surge. With no statement COVID stats coming out of the virus hotspots for 6 days a week. So, they're screwing it up for everybody else because, they just want to, right? In Florida's last 2 weekly reports, the number of new cases shot up from 23,000 to 45,000 and then 73,000 on Friday. But, no reason to report on that stuff. And averaging more than 10,000 a day. Hospitals are starting to run out of space in part of the state. Let's go ahead and shut that down. We got enough problems out here. We definitely don't want people knowing about this, right? Cases rising. Democrats and others, critics have urged state officials and Governor Ron DeSantis to resume daily outbreak updates. There are absolutely no reason to eliminate the daily updates beyond an effort to pretend like there are no updates, said Representative Anna Escamani, a Democrat from the Orlando area. The trend of reducing data reporting has alarmed infectious disease specialists who believe that more information is better during a pandemic. Imagine that. People have come to rely on state virus dashboards to help make decisions about whether to attend large gatherings or wear masks in public, and understanding the level of risk in the community affects how people respond to the virus restrictions and calls to get vaccinated. We know that showing the data to others actually is important because the actions that businesses take, the actions that schools take, the actions that civic leaders take, the actions that community leaders take, the actions that each of us individually take are all influenced by our perception of what risk is out there. said Dr. Kirsten Bibbins Domingo, who leads the Department of Epidemiology and Biostatistics at the University of California, San Francisco. Reporting on the weekly numbers reporting on the numbers on a weekly basis still allows people to see the overall trends while smoothing out some of the day-to-day variations that come from the way cases are reported and not the actual number of cases. And experts have long advised that it makes sense to pay more attention to the 7-day rolling average of new cases because the numbers can vary widely from one day to the next. So, yeah, I mean, more information is going to be more important, and you definitely can't act like this is just going away on its own, or like it's going to go away on its own, because it certainly is not. I mean, I'm at a loss for words here, but so that's what's going on in Nebraska and South Dakota and Florida. Just sheer idiocy, right? I mean, what else would you call that? There are no other words for this. Now, earlier in this video, I had shared where the Governor Mike Parson had on his personal Facebook, or on his official Facebook, right, shared a post for the Missouri Department of Health and Senior Services addressing Laclede, Phelps, and Pulaski counties and their total case counts, right? So now we're going to take a look because Missouri Department of Health and Senior Services had just posted this in the last 24 hours regarding, let's see, what is this? Howell, Oregon, Carter, Shannon, and Dent counties. Let's see, case numbers in the last 14 days. Howell County 356, Oregon County 61, Carter County 34, Shannon County 49, Dent County 70 cases. Vaccination rates in Howell County 19.6%. Do better, my God. Oregon County 18.6%, Carter County 21.1%, Shannon County 19.1%, Dent County 20.3%. Counties are below the state rate of more than 40%. Experts say at least 70 to 80% of people need to be immunity to minimize spread within a community. As I said before, the only thing that is partisan about COVID-19 and the vaccine are the morons who spread this misinformation. There's no other word for it. So, speaking of Howell County, let's jump over here. Howell County Health Department posted at 10:26 a.m. Assuming this is 10:26 a.m. Oh, this was from the previous. So this is July 23rd, 10:26 a.m. For immediate release, Howell County Health Department reports an additional 41 cases of COVID-19 for Howell County. This brings the total number of cases to 4,507. Of the new cases, 26 live in West Plains, 5 live in Mountain View, 5 live in Willow Springs, 4 live in Caulfield, 1 in Moody. There have been, just the fact that anybody in Moody is getting COVID. I mean, Jesus Christ. There are like 7 people who live there, so stab it. Been 22,017 tested to date. New Howell County COVID-19 dashboard. Thanks, Howell County University. Let's see. Nope, that's not the one. Let me pull this in here. So now one of these, I believe that was the one from the Howell County. And I'll show this to you. So when Governor Parson had posted his initial post on the 20th, that included this. Nope. That included this neat little map. Coming from the States. Of course, county hotspots and whatnot. Now we're looking at Wright, Christian, Dallas counties, right? Are definitely something to consider. So compare that to from July 20th. Compare that to what they had posted just yesterday. Welcome to the club. You're in. All right. Boy. Just a matter of time, folks. And the further east you get from Greene County, it's just more rural until you get to Howell County, and Howell County is probably the most suburban area that and further Wayne County, Butler County, started, all the way over to Scott County is also very rural communities. That's it, man. So definitely something to consider. If we're screwed, there's only one reason why. That's a thing. So finally, Texas County. You guys know about this place? Texas County. Texas County had 0 cases for the majority of 2020. 0 cases. None. No confirmed cases whatsoever. As counties across the state, as states across the country, were dealing with their surge of COVID, Texas County just simply did not have a problem with COVID-19. I think it was because of the isolation, firstly, and obviously the sparsely populated rural areas. But so Texas County Health Department just posted this the other day. A bunch of sadness what they posted. Texas County Health Department reports an additional 123 positive COVID-19 tests, including 8 breakthrough vaccine cases and 1 COVID-19 related death, 7/17 through 7/23/21. Total to date summary: active in-home isolation 112 from 0. Less than a year ago there were 0 cases. Okay, less than a year ago there were 0. Currently hospitalized 11. What do you think the percentage of recoveries are going to be? I recovered off isolation, 2,058. Total cumulative to date, 2,181. Deaths, 26. Total breakthrough cases, 18. None were hospitalized. So, something to think about. Something to definitely think about. That's all I got for you. Good night. Good luck.